So main aims of a LeDeR program are, as I said, service improvement, so improving the services for people with learning disabilities and autistic people. Reducing the health inequalities people with learning disabilities and autism face. We know that there's significant health inequalities this group of people actually faces. Reducing the premature deaths and early deaths in people with learning disabilities and autism. So those are three key kind of aims of this program.
It came out of some concerns that were raised in an inquiry into the premature death of people with a learning disability. The purpose of it was to look at whether there were lessons that could be learned or whether there was anything specifically that was becoming a trend.
People with a learning disability and or autism die a lot earlier than the normal population, and there is a lot of health inequalities around that, and anything that we can do to improve that, I think, is for the best for those people with a learning disability.
One of the best initiatives that have come out of the LeDeR programme locally has been the introduction of the health passport. I'm very proud to say that as a system we were nominated for a Nursing Times Award on a national level for the contribution that this health passport makes. But actually what the health passport does is brings together in one simple document all the key requirements an individual will need when they present themselves, for example, at a GP surgery or accident and emergency department, so that their transition into receiving care and treatment is as smooth as it possibly can be. Just in the same way that you or I will be able to articulate that, it takes that pressure off in terms of having a documented record of what those needs are.
Locally, there's definitely been improvements around annual health checks in GP surgeries for those that are on the learning disability register. We have done things around improving training for staff around learning disabilities and autism, and also sharing some of the learning that comes out of the reviews and how we can improve patients' experience when they're with us.
The LeDeR will produce a national report yearly so that we look at the trends, and there is evidence that some of the areas that were a concern, so people dying of aspiration pneumonia, has reduced. In South Staffordshire we're also producing a training tool for staff, particularly in social care, around eating and drinking and the issues with people having dysphagia, which is a swallowing problem.
In 2022 report, we've seen that around 50% reduction in deaths from pneumonia in people with learning disabilities and autism. So this program has already started to make a significant improvements in the care and the quality of care these people actually experience.
Raising the awareness of the needs of individuals with learning disabilities has always been a real challenge, and I think the LeDeR programme has helped us to bring that forward and make more and more people aware at every level throughout health and beyond what the potential impact of their actions will be, and enabled us to really continue to pursue a high quality service for these individuals.
Once a death is reported, it is allocated to a reviewer for initial review. So there's two stages. So it's initial review where they see if they need further information on the death. They speak to a family member, and they might speak to a GP or review GP records or hospital records or care records to see if there were any lapses in the care. If they think that review needs further investigations or further looking into, then a focused review is commissioned.
So I'm involved with the governance panel with the LeDeR programme as the independent chair. We host the meeting once a month, and we normally bring 2 cases to be reviewed and to look at in more in-depth way to look at the learning and actions that need to come away from that case. So we'll have the reviewer of the case that will go through each case individually, give us a real good picture of what happened, a bit about the person, how they were, the conditions that they had, the disabilities that they had. And we look at their death and what happened around that death, things that could be improved, and elements that work well.
We discuss improvement required locally and pathways which need improvement. Also, we identify the good practice and we share with our GPs and other clinical colleagues and health and care colleagues. We share that learning.
Well, I'm hoping that health inequalities will reduce, that, you know, as people become more aware of the needs of people with a learning disability or autism, that those will reduce, that more people will have an annual health check, and those issues that people die prematurely from will be picked up sooner.
We've had a lot of interaction from staff since they've done the training and wanting to learn more. We've had a medic recently who's contacted our learning disability specialist nurse and asked if they could shadow her during the day to see how they can make improvements in regards to caring for people with a learning disability when they're with us.
We're looking to how we can innovate and be more creative locally to make sure we take the maximum opportunity and maximum learning. And a really good example of that is now we're an integrated care system. We collaborate with partners in the local authorities and in the police force, for example, and using those collaborative networks that we have, we'll be able to work very closely with housing and with our police partners to make sure that the continued spread of the learning from the LeDeR programme goes beyond the boundaries of the health service.